Hi, my name is Jessica Carlin. I'm the third presenter for Group 10. I'm going to be speaking out the Medicare changes pertaining to or related to the community health centers. The first bullet on my PowerPoint is higher reimbursement for services performed. The government rolled out the prospective payment system. The Affordable Care Act mandated development of a prospective payment system, also known as PPS, for Medicare payments to community health centers beginning on October 1st, 2014, and requires that Medicare payment under the community health center PPS shall be 80% of the lesser of the actual charge or the PPS rate. The PPS is designated to reflect the cost for all services associated with a comprehensive primary care visit, even if not all the services occur on the same day. Standalone billable visits are typically evaluation and management (E&M) type of services or screenings for certain preventive services. The professional component of a procedure is usually a covered service, but it is not a standalone billable visit, even when furnished by a community health center practitioner. Community health centers began transitioning to the PPS system, in which Medicare payment is made based on the national rate, which is adjusted based on the location of where the services are furnished. The rate is increased by 34.16% when a patient is new to the FQHC or an initial preventive physical exam IPP, which is performed the first year when the patient becomes Medicare eligible, or an annual well visit is furnished, which an annual well visit is then done year 2 going forward. This is going to be beneficiary for the community health center case 16, as they're lacking contracts with these managed care plans due to Medicaid rolling out with managed care. They will be receiving a higher reimbursement now for Medicare, and it will hopefully help balance them out in some sort of way. Community health centers receive encounter rates. An encounter rate is made of an all-inclusive encounter to the community health center. This payment can be made in addition to payments for other qualifying visits on the same day. For an example, you can see your behavioral health provider on the same day that you see your PCP services. Your PCP provider, both services are reimbursed 2 encounter rates for 1 day, although you cannot see 2 primary care physicians in 1 day. One Medicare will make an encounter payment for 1 provider and will include that second visit into the first encounter rate. So you will receive 1 encounter for those 2 PCP visits. Another change that Medicare has made is sequestration. The Budget Control Act of 2011 requires, among other things, mandatory across-the-board reductions in federal spending, also known as sequestration. The American Taxpayer Relief Act of 2012 postponed sequestration for 2 months. As required by law, President Obama issued a sequestration order on March 1st of 2013. This is directed at the Medicare fee-for-service program, which is Part A and Part B only. In general, Medicare fee-for-service claims with date of services or date of discharge on or after April 1st of 2013 will incur a 2% reduction in Medicare payments. This will mean for this 1 encounter rate that I was speaking of that these community health centers are receiving per day per visit is now going to be reduced by 2%. Also, this 2% will also be applied to the Medicare EHR incentive payments for a reporting period that ends on or after April 1st of 2013. If the final day of the reporting period occurs before April 1st, 2013, those incentive payments will not be subject to the deduction. Now to get into the ACA changes pertaining to Medicare in a community health center setting. There'll be expanded prescription drug coverage. The health reform law provides a $250 rebate for individuals who fall into the coverage gap in 2010 with Medicare Part D. The rebate will go to an estimated 3.4 million beneficiaries who fall into the coverage gap this year. Also, another change is improved low-income subsidy for drug coverage. This means if a couple qualifies for a subsidy and one of the spouses dies, their surviving spouse can continue to receive the subsidy for a full year before his or her eligibility for the subsidy is redetermined. Additional funding is also provided under the reform law to make certain that eligible people know about and sign up for the subsidy. Another change is expanded coverage for preventive services. Currently, Medicare covers only certain preventive services, such as mammograms and colonoscopies. Beneficiaries have to pay 20% of the amount that Medicare allows for these services. Beginning January 1st, 2011, that will change, or it did change. Colonoscopies and other colorectal cancer screenings will be done at no charge to beneficiaries. Medicare also pay full cost of an annual wellness visit. This will be beneficiary to the community health center in case 16. Well, actually, to all community health centers, as they see low income individuals or individuals with minimal income to pay for their services. So this will go ahead and assist them in providing more information for them so they can qualify for these types of programs. Another change is the primary care improvements. Medicare payment rates tend to be higher for the type of services provided by specialists than the types of services typically provided by primary care practitioners. The new law provides a 10% increase in payment for primary care services provided by primary care practitioners if at least 60% of their Medicare changes in a prior period were for primary care services. And that's all I have. Thank you very much.